This lecture is just going to involve a basic A&P of female and male genitalia, as well as some common disorders or diseases, not to include STIs. STIs are included in these slides. However, because students have been assigned an STI project, the lectures regarding STIs will come from students and be peer-to-peer. Please see Blackboard for more information on your STI project, due dates, when to submit it, and the follow-up assignment. Sexual organs require healthy functioning and responses to chemical, which are mostly hormonal triggers. The sexual organs and hormones decrease their functionality as people age. The hormonal process of ovulation, menstruation, and developing puberty require a condition of FSH, LH, healthy ovarian functioning with egg release, and then the luteinizing hormone increases if no fertilization occurs. Testosterone is the primary sex organ in males. The first phase in puberty is testicular enlargement. Testosterone is responsible for the onset of puberty. The testes are located in the scrotum, which protects and maintains them at a temperature slightly lower than body temp. The epididymis transports sperm from the testes to the vas deferens, where they are stored. The vas deferens connects to the urethra. Neonatal circumcision is often performed on newborns, typically within the first few days to weeks after birth. It is often done for religious, cultural, or for perceived health benefits. Childhood or adolescent circumcision can be performed in childhood or adolescence for medical reasons, such as recurrent infections or other complications. Adult circumcision is generally performed for medical or personal reasons during adulthood. It may be recommended for recurrent infections. Although the decision to circumcise is often influenced by cultural and religious practices, there are several potential health benefits associated with circumcision, although these may vary in significance. One is the prevention of UTIs. Studies suggest that circumcised males may have a lower risk of developing UTIs in infancy. Reduction risk of STIs. Circumcision may reduce the risk of certain STIs, including HIV, genital herpes, and HPV. Prevention of phimosis, which is a condition of the foreskin where it cannot retract over the glands. Prevention of balanitis, which is an inflammation of the glans penis, often caused by poor hygiene or infection. Reduced risk of penile cancer. Though penile cancer is rare, circumcision has been shown to decrease the risk of developing this type of cancer, particularly in men who are not regularly circumcised. Improved hygiene. Without foreskin, cleaning the penis may be easier, and there is a lower risk of accumulation of smegma, or a substance that can lead to irritation or infection. However, like any surgery, there are some risks and complications of circumcision. The procedure is generally safe, but complications can occur to include infection, bleeding, pain and discomfort, and damage to the penis. In rare instances, circumcision can lead to complications that damage the glands when incorrect removal of too much or too little skin or scarring. Psychological impact. For some, circumcision can have psychological effects, especially if done later in life or if the individual is not in agreement with the procedure. Loss of sensitivity. There are concerns about potential loss of sensation in the glands due to the removal of the foreskin, though research on this subject has been inconclusive. Cultural and religious considerations. In Judaism, circumcision is considered a religious covenant and is typically performed on the 8th day after birth. In Islam, circumcision is a common practice performed on male children as a rite of passage and a sign of cleanliness. In other cultures, circumcision is also practiced in various African and Pacific Islander cultures, often as a rite of passage into adulthood or as a part of tribal customs. The practice of circumcision varies greatly by country and culture. In some parts of the world, it's routine for all males, while in others, it may be a personal or religious choice. In recent years, there's been an ongoing debate regarding the ethics of routine neonatal circumcision, especially in countries where it is not widespread practice. Advocates argue that the health benefits outweigh the risks, while opponents focus on individual rights and the possibility of harm. Post-circumcision care includes keeping the area clean and dry, applying petroleum jelly or antibiotic ointment to prevent infections, avoid tight clothing that could cause friction, manage pain with over-the-counter medications as recommended by a healthcare provider. Healing generally takes 1 to 2 weeks for a newborn, although it may take longer for older adults or children. Breasts begin to develop by about 6 weeks of gestation. The increase in estrogen levels during puberty cause the breasts to grow and milk ducts to develop. The expected changes in estrogen levels during the menstrual cycle stimulate the breast tissue. This may cause the client to notice pain, swelling, or lumps during the menstrual cycle. While menstruation can vary from person to person, abnormal menstruation typically refers to periods that are either heavier, lighter, more painful, or irregular in timing. Normal menstruation cycles last between 21 and 35 days, and menstrual bleeding typically lasts from 3 to 7 days. However, any significant change in frequency, duration, or the amount of menstrual flow can be considered abnormal. Types of abnormal menstruation include amenorrhea, which is the absence of menstruation, and it can be primary or secondary. Primary is when a woman has not started her period by age 16, and secondary is when a woman who has had her period stops menstruating for 3 or more months. Menorrhagia is excessive or heavy menstrual bleeding that typically lasts longer than 7 days, or when bleeding soaks through 1 or more pads or tampons every hour for several hours. Menorrhagia is irregular bleeding between periods. This refers to bleeding that occurs outside the regular menstrual cycle, including spotting or bleeding between periods. Oligomenorrhea is infrequent menstrual periods. This refers to periods that occur more than 35 days apart. A woman with oligomenorrhea may only have 4 to 9 periods a year. Polymenorrhea means frequent menstruation. This refers to menstrual periods that occur more frequently than every 21 days. Dysmenorrhea is painful periods and can include severe menstrual cramps that interfere with daily activities, often caused by an overproduction of prostaglandins. Hypomenorrhea is light menstrual bleeding. Certain medications, including birth control pills, HRT, blood thinners, and anti-inflammatory drugs, can influence menstrual cycles. IUDs, particularly non-hormonal ones, can cause irregular bleeding or spotting. Infections such as PID or other infections of the reproductive organs can lead to irregular bleeding and pelvic pain. Chronic conditions like diabetes, obesity, and autoimmune diseases can also disrupt the menstrual cycle. Cancer can cause abnormal bleeding and can be a symptom of uterine, cervical, or ovarian cancer, although this is less common. Diagnosis of abnormal menstruation. If a woman experiences abnormal menstruation, a healthcare provider will typically conduct a thorough assessment to determine the underlying cause. Some steps involved in the diagnosis may include medical history, such as asking about your menstrual cycle, changes in periods, and life factors. A physical exam to include a pelvic exam. Blood tests to check for hormone imbalances such as thyroid function, estrogen, progesterone, and prolactin levels. A transvaginal ultrasound can help identify uterine conditions, and an endometrial biopsy. A hysteroscopy can also be done, which involves inserting a camera into the uterus to examine the uterine cavity and take biopsies if necessary. A pap smear is done routinely or if there is a concern about cervical health or abnormal bleeding. Treatment options for abnormal menstruation include hormonal therapy such as birth control pills, IUDs, progestin therapy, or GnRH agonists. Surgical options include a DNC, endometrial ablation, and even a hysterectomy. Medications for pain management include NSAIDs, which can help alleviate cramps and pain, lifestyle modifications such as stress management, maintaining a healthy weight, regular exercise, and a balanced diet, as well as management of underlying conditions such as PCOS, thyroid disorders, and fibroids. Women should seek medical attention if they experience any of the following symptoms: absence of menstruation for several months, especially if previously regular periods were present, excessively heavy bleeding that requires changing pads or tampons every hour, severe pain during menstruation that interferes with daily activities, bleeding between periods or after intercourse, significant changes in menstrual cycle length, and irregular or missed periods in women who are not pregnant and do not have a recent history of stopping birth control. Endometriosis is when tissue can be found on the ovaries, fallopian tubes, and the outer surface of the uterus or other organs in the pelvic area. In rare cases, it may be found in other parts of the body. During the menstrual cycle, the endometrial tissue inside the uterus thickens, breaks down, and sheds in response to hormonal changes. However, the tissue growing outside the uterus behaves differently. It still reacts to hormonal changes, but since it's got nowhere to go, it becomes trapped, leading to inflammation, scarring, and adhesions. Over time, this can lead to significant pain and other complications. The symptoms of endometriosis in severity can vary significantly from person to person. While some women experience mild discomfort, others endure severe pain and complications. Common symptoms include pelvic pain, which is one of the hallmark symptoms of endometriosis. The pain often worsens during menstruation and may become more severe over time. Some women may also experience pain during intercourse, urination, or bowel movements, particularly during menstruation. Heavy or irregular menstrual bleeding, painful periods, infertility. Endometriosis is one of the leading causes of infertility, as it can interfere with the normal function of ovaries, fallopian tubes, and uterus, making it difficult for some women to become pregnant. GI symptoms such as bloating, nausea, diarrhea, constipation, or painful bowel movements are common. Fatigue, chronic, or always feeling tired, low back pain. Causes and risks. The exact cause of endometriosis is unclear, but several theories exist. Possible contributing factors include retrograde menstruation, when the menstrual blood backflows backward through the fallopian tubes and into the pelvic cavity, carrying the endometrial cells with it. Embryonic cell transformation, immune system dysfunction, genetics, endometriosis may run in families, and environmental factors. The diagnosis can be challenging, as many symptoms overlap with other conditions such as PID, IBS, or even ovarian cysts. First, you will have a pelvic exam and a transvaginal ultrasound. MRI may be necessary to help identify larger endometrial lesions, and lastly, a laparoscopy. This is the gold standard for diagnosing, as it is a minimally invasive surgery where a small camera is inserted through an incision in the abdomen. Treatment of endometriosis, medications such as NSAIDs, hormonal therapy like birth control, progestin, GnRH, agonists or antagonists, and an IUD. Aromatase inhibitors may also be used in combination with other treatments. Surgical options include a hysterectomy and a laparoscopy. Fertility treatments may be needed, such as IVF, and lifestyle and home changes. Dietary changes. Some women find relief by changing their diet to reduce red meat intake and increase fruits and vegetables. Exercise helps alleviate pelvic and back pain, and heat therapy. The impact on quality of life. Endometriosis can significantly affect a woman's quality of life, particularly because it causes pain, emotional distress, and may interfere with fertility. In a healthy uterus, the endometrial tissue sheds each month during menstruation. However, in adenomyosis, parts of this tissue become embedded in the muscle wall of the uterus. As a result, during menstruation, this tissue still responds to hormonal changes, thickening, breaking down, and bleeding. But since it's trapped within the uterine muscle, it can't be shed, leading to inflammation, pain, and sometimes an enlarged uterus. The symptoms of adenomyosis can range from mild to severe. Some women have no symptoms at all. Heavy menstrual bleeding, painful periods, pelvic pain or pressure, enlarged uterus, pain during intercourse, fatigue, and infertility are all symptoms. The exact cause is not fully understood. However, several factors may contribute to the development of the condition, such as a hormone imbalance in where estrogen plays a role in the development of progression of adenomyosis. Age, it's more common in women in their 30s and 40s, especially those who have had children. Childbirth, women who have had multiple pregnancies are at higher risk. Previous uterine surgeries, such as a C-section or myomectomy. Endometriosis, and a family history. To diagnose adenomyosis, it can be difficult because symptoms overlap with other conditions. A pelvic exam and ultrasound can be done, as well as an MRI or a hysteroscopy, and an endometrial biopsy. Treatment for adenomyosis depends on the severity of the symptoms, the woman's age, reproductive plans, and overall health. Medications like NSAIDs may be prescribed. Hormonal therapy such as birth control, IUD, progestin, and GnRH agonists. Aromatase inhibitors may also be prescribed. An endometrial ablation may be done, as well as a hysterectomy and a myomectomy. Lifestyle and supportive changes, such as dietary changes, exercise, heat therapy, and stress management. Adenomyosis can significantly impact a woman's quality of life due to chronic pain, heavy bleeding, and potential fertility issues. Uterine fibroids are a non-cancerous growth that develops in or on the uterus. They're made of muscle and fibrous tissue and are also known as myomas or gliomas. These growths can vary in size from tiny seedlings to large masses, and they may appear singly or in clusters. Fibroids are a common condition, especially in women of reproductive age, and their exact cause is not well understood. The types of uterine fibroids are submucosal, which grow just beneath the lining of the uterus in the endometrium. They can cause heavy menstrual bleeding and may affect fertility. Intramural fibroids grow within the muscular wall of the uterus and are the most common type and may cause pain or heavy bleeding. Serosal fibroids grow on the outer surface of the uterus and may become quite large and can press on nearby organs. Pedunculated fibroids are attached to the uterus by a stem-like structure and can grow inside the uterus or outside the uterus and may twist, causing severe pain. Many women with fibroids experience no symptoms at all, and the fibroids are discovered incidentally during a pelvic exam or imaging study. However, when symptoms are present, they can vary in severity and may include heavy menstrual bleeding, pelvic pain or pressure, frequent urination, constipation, back or leg pain, and infertility or pregnancy complications. The exact cause of uterine fibroids is unknown, but several factors may contribute to their development, including hormones such as estrogen and progesterone, genetics, age, race. African American women are more likely to develop fibroids and experience more severe symptoms. Obesity. Overweight women are at a greater risk of fibroids, possibly due to the higher estrogen levels. Diet. A diet high in red meat and low in green leafy vegetables may increase the risk. And pregnancy. To diagnose a uterine fibroid, you would have a pelvic exam, an ultrasound, possibly an MRI, and a histosonography, as well as a hysteroscopy and a laparoscopy. Treatment options include watchful waiting if the fibroids are small and causing no symptoms, medications such as NSAIDs, hormonal treatments, gonadotropin-releasing hormones, and anti-inflammatory drugs, as well as minimally invasive procedure known as a uterine artery embolization, an MRI-focused ultrasound, or a myomectomy. Surgical options also include a hysterectomy. Alternative therapies such as acupuncture, herbal supplements, or dietary changes may help manage fibroid symptoms. While fibroids themselves are not cancerous, they can cause significant problems. PMS refers to a group of symptoms that occur in the luteal phase of the menstrual cycle, usually 1 to 2 weeks before menstruation, and typically subside after the onset of menstruation. While PMS is common and can be mild for many women, it can also significantly impact the quality of life for some women. The intensity of symptoms can vary, but when severe, PMS can interfere with daily activities, work, relationships, and overall well-being. PMS encompasses a wide range of physical, emotional, and behavioral symptoms, which can vary in severity. Physical symptoms can include bloating, breast tenderness, fatigue, headaches, joint or muscle pain, cravings, sleep disturbances, and even acne. Emotional and behavioral symptoms include mood swings, depression, anxiety, social withdrawal, difficulty concentrating, and aggression or increased sensitivity. The impact of PMS on the quality of life depends on the severity of the PMS symptoms. For some, symptoms are mild and manageable, while others experience more intense symptoms that can interfere with daily routines and functioning. The impact of PMS on quality of life can include emotional well-being, work and productivity, social and interpersonal relationships, physical health. While PMS can impact the quality of life, managing it can improve quality of life. Several strategies can help manage symptoms. The approach to managing symptoms is based on the severity and individual preference. Lifestyle modifications with a diet rich in fruits, vegetables, and whole grains, exercise, and good sleep hygiene. Stress management, such as mindfulness and meditation, and medical treatments such as pain relievers, antidepressants, hormonal therapies, diuretics, and even calcium and magnesium supplements. For women with significant emotional symptoms, cognitive behavioral therapy may be an effective option. Alternative therapies include acupuncture, herbal remedies. There are several dysfunctional conditions that can severely affect the quality of life and health of women. PMS is a physical and psychological challenging condition. Dysmenorrhea is thought to be caused by excessive secretion of a prostaglandin and vasopressin, which can cause uterine contractions. Clients are at higher risk for dysmenorrhea if they use tobacco, have a high BMI, or have depression or anxiety, or had the onset of menarche at an early age. Other medical conditions that may be present in a client who has dysmenorrhea often include obesity, depression, and anxiety. Dysmenorrhea affects up to 91% of female clients of reproductive age prior to the onset of menopause and is one of the most common causes of pelvic pain. Severe pain is experienced by up to 29% of female adults and 40% of female adolescents. Amenorrhagia includes pregnancy, hormone imbalances, tumors, and weight loss. These lead to hormone imbalances that prevent ovulation and menstruation. This affects approximately 1% of females, and in clients who have had amenorrhea are also at risk for osteoporosis and wrist and hip fractures. PMS and PMDD affect approximately half of the females that experience PMS during their reproductive years. Amongst those who experience PMS, about 2 to 3% will have severe depression and develop a decreased ability to interact socially. These manifestations are associated with progression to PMDD. The cause of PMS and PMDD is unclear, but it is most likely due to hormone fluctuations. These hormone fluctuations lead to a serotonin deficit that triggers fatigue, insomnia, and depression that are commonly manifested with these diseases. Dysfunctional uterine bleeding can be caused by many factors, including uterine structural abnormalities, tumors, bleeding disorders, and abnormal ovulation. It's most common at the onset of menstruation or during perimenopause and can be acute or chronic. Approximately 1/3 of females experience dysfunctional uterine bleeding. Endometriosis we discussed, as well as uterine fibroids. Postmenopausal refers to the phase of life after a woman has gone through menopause, which is marked by the end of menstrual periods for 12 consecutive months and typically occurs between the ages of 45 and 55. This stage is characterized by hormonal changes that can significantly impact a woman's physical, emotional, and mental health. Managing menopause is important for maintaining quality of life, preventing chronic diseases, and supporting overall health. Key areas of postmenopausal health include hormonal changes and symptoms driven by estrogen decline, such as hot flashes and night sweats, vaginal dryness, mood changes, sleep disturbances, and memory and concentration issues. Bone health, such as osteoporosis, which can be prevented with adequate calcium and vitamin D intake and weight-bearing exercises. Women need a bone density test or a DEXA scan. Heart health. You are at increased risk of heart disease after menopause. Having regular physical activity and practicing a heart-healthy diet are good prevention risks. Weight management due to changes in metabolism can be combated with healthy eating, physical activity, and strength training. Sexual health can impact vaginal dryness and atrophy. Women can be educated to use lubricants and moisturizers or local estrogen therapy. For decreased libido due to hormonal changes, open communication with partner and seeking advice from healthcare providers can be beneficial. Urinary incontinence is common, and pelvic floor exercises in combination with a healthy lifestyle may help improve urinary health. Thinning skin and hair are common, as well as mood swings and depression. Antidepressant medications may be prescribed. Cancer risk and screening. Women need to have breast cancer and endometrial screenings, as well as ovarian cancer risks may increase in postmenopausal women. There are some hormone replacements, and the benefits of HRT may be prescribed to combat hot flashes, vaginal dryness, and mood swings. There are risks with HRT, especially in those who smoke. There are several types of hysterectomies depending on what parts of the reproductive system are removed. A total hysterectomy removes the entire uterus and cervix. A subtotal or partial, the uterus is removed but the cervix is left. In a radical hysterectomy, this is a more extensive surgery typically performed if there's cancer, and it involves removal of the uterus, cervix, parts of the vagina, and nearby tissues and lymph nodes. Last is a hysterectomy with an oophorectomy, and this includes removal of the uterus and one or both of the ovaries. Reasons for hysterectomy can be uterine cancer, fibroids, endometriosis, chronic pelvic pain, uterine prolapse, abnormal uterine bleeding, infections or abscess, and cancer. A hysterectomy can be performed 3 ways. Abdominal is the most common approach when the uterus is large or when there are other complications. Vaginal is when the uterus is removed through the vagina. This method may have a faster recovery time and less scarring. And last is a laparoscopic or robot-assisted hysterectomy. This is where the uterus is removed through a small incision made in the abdomen. This is a minimally invasive technique and often results in less pain, shorter hospital stays, and quicker recovery times. Like any surgery, a hysterectomy carries risks, including bleeding, infection, damage to surrounding organs, blood clots, hormonal changes, and emotional and psychological effects, as well as pelvic organ prolapse. Recovery and aftercare time varies depending on the type of surgery. A hysterectomy is a major surgery, and women may experience a range of emotions following a procedure. These may include feelings of sadness, loss, or a sense of change, especially if the surgery involved removing the ovaries. It's important to address these feelings with a healthcare provider, counselor, or support group. For many women, the benefits of a hysterectomy, such as relief of pain, bleeding, or risk of cancer, outweigh the emotional or physical challenges. However, this is a deeply personal decision. Breast problems can affect both men and women, although they are more common in women. These problems can range from benign conditions to more serious ones, such as breast cancer. It's important to be aware of any changes in the breast area, as early detection and treatment can make a significant difference, especially in the case of cancer. Breast pain or myalgia is pain in the breast area which can be cyclical or non-cyclical. Causes are hormonal changes, fibrocystic breasts, infections, injury or trauma, and even caffeine. Treatment is to wear supportive bras, over-the-counter pain relief, hormone treatments, warm or cold compresses. Breast lumps is a lump in the breast that can be a common concern, although most lumps are benign. Causes: fibrocystic changes, cysts, fibroadenomas, infections, and even breast cancer. Treatment is an ultrasound or biopsy, observation, and possible surgical removal. Mastitis is an infection of the breast tissue that causes inflammation, pain, and sometimes redness. It is more common in breastfeeding women. Causes are bacterial infection and engorgement. Symptoms may include pain, redness, or swelling in one part of the breast, flu-like or fever, and tenderness or warmth. Treatments can be antibiotics, frequent breastfeeding or pumping to relieve engorgement, warm compresses, and in severe cases, drainage of the abscess. Nipple discharge is any fluid that comes from the nipple that is not milk. It can be normal during certain stages of life like pregnancy or breastfeeding, but can also be the sign of an underlying infection or underlying issue. Causes: hormonal changes, infections, benign conditions, and breast cancer. Treatment is evaluation, possible surgical removal, or hormonal treatments. Gynecomastia is male breast enlargement, often due to hormonal imbalances or underlying conditions. Treatments can be hormonal treatment, surgery, or addressing underlying conditions. We talked about breast cancer last week. Last is fibrocystic breast changes, which are benign changes in the breast tissue that results in lumps, pain, or tenderness, often related to the menstrual cycle, caused by hormonal fluctuations, particularly estrogen. Treatment: pain relief, lifestyle changes such as reducing caffeine or wearing a supportive bra, and monitoring. We just talked about the prostate last week. However, prostate problems are common among men as they age. BPH, or benign prostatic hyperplasia, is a non-cancerous enlargement of the prostate gland. As men age, the prostate often becomes larger, which can press against the urethra, causing urinary symptoms. The exact cause is not fully understood. However, symptoms are frequent urination, weak or interrupted urine flow, difficulty starting or stopping, a feeling of incomplete bladder emptying, and urinary urgency. Treatment often includes medications like alpha blockers that relax the prostate muscle and 5-alpha reductase inhibitors to shrink the prostate. There are minimally invasive procedures or surgical procedures such as a TURP. Prostatitis is an inflammation or infection of the prostate gland. It is caused by often bacterial infections, but chronic prostatitis may not have a clear cause. Symptoms are pain or discomfort in the lower abdomen, groin, or pelvic area, painful urination, painful ejaculation, flu-like symptoms, and sexual dysfunction or erectile problems. Treatment is antibiotics, pain relievers, alpha blockers, and prostate massage or pelvic floor therapy. We discussed prostate cancer last week. Prostate enlargement or prostatic hyperplasia is when the prostate can grow and often leads to symptoms similar to BPH, but this is a general term to describe the growth without indicating benign or cancerous nature. Prostate stones are small, hard deposits that form within the prostate gland. They can develop from bacteria, prostate fluid, or calcification from aging. They are often asymptomatic. However, if symptomatic, they can cause pain during urination, pelvic discomfort, or difficulty urinating. Treatment is antibiotics or surgical intervention. Erectile dysfunction is the inability to achieve or maintain an erection sufficient for sexual intercourse. Causes can be physical, such as diabetes, heart disease, hypertension, obesity, psychological, or lifestyle factors. Treatment is medications, psychotherapy, lifestyle changes, or even penile implants. Premature ejaculation, or PE, is ejaculation that occurs sooner than desired, typically before or shortly after penetration, often within a minute. Physical causes are hormonal imbalances, abnormal reflexes, or neurological issues. Psychological causes are anxiety, stress, or early sexual experiences. Treatment is behavioral techniques, start, stop, or squeeze techniques, and medications, as well as counseling. Delayed ejaculation is the inability to ejaculate or delay an ejaculation during sexual activity despite adequate arousal. Physical causes can be nerve damage, certain medications, or hormonal, and may have psychological causes. Treatment is medication adjustments, psychotherapy, and sex therapy. Low libido is a reduction in sexual desire or interest. Physical causes can include low testosterone, aging, chronic illness, and psychological causes. Treatment is testosterone replacement therapy or psychotherapy. Hypoactive sexual desire disorder, or HSDD, a more persistent lack of sexual desire or interest, which can lead to a distressful or difficulties in relationships. Causes can stem from a combination of physical, psychological, or relational factors, and symptoms are persistent low sexual desire that causes distress. Treatment is hormone therapy, counseling, or lifestyle changes. Peyronie's disease is a condition where the tissue inside the penis becomes fibrous, leading to an abnormal curvature during an erection, which may cause pain and difficulty with intercourse. This can be caused from trauma or injury, genetic factors, or health conditions. Sexual pain disorders are conditions where men experience pain during or after sexual intercourse or other forms of sexual activity. Could be caused by infections, inflammation, or injury to penis, prostate, or surrounding areas. Treatment is medications or counseling and therapy. Common causes of male sexual dysfunction include cardiovascular health, diabetes, hormonal imbalances, neurological conditions, medications, or obesity. Psychological causes are stress and anxiety, depression, relationship issues, or previous trauma. Lifestyle factors such as poor diet, lack of exercise, drug and alcohol use, and smoking. As individuals age, the body undergoes various changes, and the reproductive system is no exception. For both men and women, the aging process significantly affects reproductive health, often leading to a variety of physical, hormonal, and psychological changes. These changes can impact fertility, sex, and overall well-being. These can be caused by bacteria, viruses, or parasites and affect various parts of the body, including genitals, mouth, and throat. It's important to get tested regularly for STIs, especially if you're sexually active, as many STIs can be asymptomatic and will still spread to others. Regular testing, open communication with sexual partners, and practicing safe sex are essential for maintaining sexual health. If you suspect you have an STI, get tested early so treatments can be initiated.